My name is Biederwolf. I'm originally from central Wisconsin. Went to school in La Crosse, Wisconsin. I've been practicing in the Valley for about 8 years. What I really like is when a patient comes in and has a really distinct mechanical problem, and they're certainly struggling with a certain movement or certain activity, and I like to fix it with my hands. So when that patient's on the table and I do whatever is that in that particular instance, a set of manual therapy skills, be it mobilization, manipulation, dry needling, or whatnot, and having them get up and kind of repeat whatever it is that bothered them, and have that alleviated, and not necessarily to just see them do that particular activity and retest it and be happy with that, but to kind of see the expression on their face. That's probably the coolest part of my job. Yeah, that's what I like the most about my job, by far. Yeah. I think a lot of people have, when they are prescribed physical therapy, have this kind of have an anxiety about it, maybe because they've heard from somebody else that it's will be a painful experience or something of the sort, or an unpleasant experience. So we want to get that rectified right away, and that begins with being friendly up front, making them feel welcome, making them feel like their needs are met even before we start evaluating and treating them. So so that's extremely important. Then when we get into actually treating their problem, that becomes a little bit easier to do once their comfort level, just in terms of creating almost like a home-like atmosphere is I think important for people. Quality care, I think, is tailor-made for a particular individual, which I think is a skill that one develops over time in terms of reading people. So some people come in with a business-like approach and just want their physical problem rectified. Other people, need a little bit more warmth, compassion, maybe are struggling emotionally with their problem, and so that becomes certainly an awareness that you get as part of their treatment as well, along with alleviating their physical problem. A great success story that we recently had was involved a pregnant woman that was very concerned about her delivery, being able to deliver her baby because of her low back pain. Her back started radiating pain into her leg, and she had a host of other symptoms, but when she contracted her abdomen as if she was going to give birth, it was excruciating. So she had a lot of anxiety in terms of being able to deliver her baby. So we were able to rectify that problem, and she was able to complete that kind of similar type of movement and contraction without pain or problems. So and ended up delivering her baby safely, healthily, without any problems or back pain. And then we later saw the little one. So that was pretty cool. Yeah.